Hi, welcome to Xstrahl Tech Talks. My name is Adrian Treverton, I'm the CEO of Xstrahl, and I'm joined today by Wilfried Goetz, who is our Technical Service Manager.
Indeed.
And we're going to talk to you about some exciting products, but first, I think, Wilfried, why don't you tell us about yourself? How did you end up coming to Xstrahl?
Well, it started, let's say, 15 years ago when I became a researcher at first at the University of Maryland, Baltimore. And I occupied a position of researcher for 12 years.
Mm-hmm.
Then Xstrahl decided to give me a position because I was also a SARRP user, and I was very interested in making SARRP a better instrument. Along with Xstrahl, we have this relationship where I was able to give ideas and receive product that would fit my purpose. For example, the SARRP instrument would come with a universal bed or a one mouse bed, and I thought that we could increase the throughput by maybe having CT with 3 mouse beds. So along with Xstrahl, we decided to make a 3 mouse bed.
And this is when you were at the University of Maryland?
Yes, I was still at the University of Maryland when we made that, along with Xstrahl, of course. I was not able to make that on my own. Then in the US, you may know, but we are able to house mice by 5 per cage. So why not deciding to make a 5 mouse bed, which is even better, high throughput, one only CT required, and 5 target at one time. So we decided to make that this year. Actually, this probably came in the new product maybe last year. And we finally have this final design this year.
So it's interesting. I mean, your experience has been a great reward to Xstrahl because it's great having customers come and work with us. And when you were one of the customers of us, and we always enjoyed supporting you. And we're delighted to have you here for the last 4 years.
Oh, cool! Thank you.
And you bring some wonderful innovation from your experience. But when you comment that in academia, I think that people tend to treat with kind of sort of fewer mice at a time compared to maybe in an industrial setting where I think you maybe have learned from the customers you've supported here that there's a kind of more demand for throughput.
Yeah, absolutely. Especially for CRO setup where maybe a user is going to have to irradiate 100, 120 mice a day. It's quite difficult to do that with only one mouse bed. This definitely accentuate, increase the throughput, makes things much faster.
Mm-hmm.
You need only one CT to incorporate 5 targets. This example is like 5 cranial targets, so the mouse will be orientated throughout the hub,
mm-hmm.
the anesthesia hub, and you can decide of putting them prone or supine, or even sideways if you want to do a parallel oppose
mm-hmm.
beam treatment on 5 cranial isocenters. If you decide to do a cognitive study, for example, you can decide also to spare the frontal lobe,
mm-hmm.
as easy as you would do with one mouse bed settings. It's really, really convenient, and I think this is going to be very successful. CRO or even university academia will find definitely the usage of the 5 mouse bed for sure.
And does it limit your use of the SARRP at all by having such a large mouse bed installed in the system?
No, the SARRP, even though it's a very small, instrument, it doesn't take too much real estate, but it can really fit this bed very easily. The X-ray tube, the gantry can rotate around it. The stage can rotate on its own. We designed it to fit the space definitely. Mm-hmm. So. No problem at all with that.
And you even have the integrated anesthesia into that system?
Yeah. The anesthesia will come from those hubs, and you may not see, but you have space for both isoflurane and scavenging gas. So, and everything will be going through this as well, will be routed underneath the stage, mm-hmm. and shoot out on the back of the SARRP. So everything is integrated nowadays, yeah.
And I guess you can set multiple isocenters, so you can treat each mice individually.
Absolutely, that's easy to do with SARP. You don't have to have only 5 isocenter. You can have like 10, 15, as many as you want. The treatment planning software allows you to. I don't know even the limit of the treatment planning software. It might be like hundreds of isocenters.
And I guess one thing that I've always thought about the SARP is we do be able to do these conical arcs. So do you think you could do arc treatments on these mice by using the conic section rather than doing an arc in the traditional way?
You can do traditional, conventional, or conical arc the same way with the 5 mouse bed as you would do with the 1 mouse bed. Yes, absolutely.
Fantastic. And 5, of course, is the magic number because that's how many mice they have in a
Yeah, it makes total sense because if you don't have a 5 mouse bed, and especially, you know, since we are using a CBCT, you cannot have any metal, so the ear tags have to be taken apart. Then you have to mark the tail of the mouse, you know, 1, 2, 3, and 0. Well, you don't have to do that if you have 5 mice at a time because they will all receive the same treatment. Then it's become a treatment per cage. So it's less work for the user as well. It's also less prone to errors because when you pick up mouse 1 at a time or 2 and 3, you can make mistakes like that. Less handling, yes.
Fantastic. Thank you very much, Wilfried.
No problem.